Welcome to our session on understanding resilience and M&E of interventions, where we are presenting insights from the Climate Resilience Alliance. So us is basically my colleagues Raquel Guimares and Zhang Yiyun and myself, Reinhard Mechler of IIASA. We're like an international think tank operating out of Vienna. So excited to be somewhat in Berlin and even have Raquel as a Brazilian in our team. So I think we understand a bit what's happening, and ideally would like to get in touch and to get into a conversation on issues. The work we're presenting is part of, we are excited to be in the evidence pavilion. We are presenting evidence on how to understand resilience, but we're also trying to convey evidence on how to make an impact on resilience, namely building resilience. And we'll do that over the next 15 to 20 minutes. And then we'll be excited to hear your comments, questions, critiques, ideally. Yeah. So could we go to the next slide, please? It works. Yeah, so it's about measuring and managing resilience, climate resilience being that. The Zurich Climate Resilience Alliance operates in more than 50 countries and 500 communities across the globe. It's about measuring what it is, what resilience is, but it's also about implementing actions on resilience. So can we go to the next slide, please? It's working in complex environments. So there's a totally resilience imperative, build resilience for those most vulnerable, but also knowledgeable. People are not victims and helpless quite often. Can we support them in their resilience quest? That's the Zurich Climate Resilience Alliance, where we have this co-developed theory of change. I won't introduce the theory of change in detail, but you see on top what the ambition is. Namely, it is to make sure floods, and now it's also other climate hazards, don't have an impact on people's ability to thrive, people's business, but also communities' ability to thrive. That's a heavy call on people. But that's what we are after with key NGO partners that you see on the right-hand side. It's a global alliance. Next slide, please. I just want, the practitioner's perspective is about hazards, it's about preparedness, but it's a lot about livelihoods, better lives and livelihoods for people. So it's really this transformational imperative, making sure people are better off, even though they're faced with like major threats as part of the climate emergency that we're all faced with. The Climate Resilience Alliance, the Zurich Climate Resilience Alliance, has a big ambition, so reaching 500 communities, which we're doing, then 5.5 million people positively impacted, and another 70, so in our communities, and another 70 million to be impacted across the globe till 2035. Ambitious, but hopefully possible. Let's go to the next slide, please. Yeah, as part of our work, we developed the CRMC, so that's a climate resilience measurement tool where we measure capacity for implementing resilience actions. Capacity frame is natural, physical, human, financial, social. We're trying to find out from communities and households what can they do and what can be implemented. And you see some photos how we're interacting with those across the globe. And you see here, that our alliance is global. We got this measurement tool. We validated it. We are doing a baseline assessment. Then NGO partners come in and they implement, they take action. They have an endline assessment, what worked and what did not work. It's not about the numbers, but it's really the process. And we would argue this measuring part is also like an intervention because it builds awareness, it builds capacity, it builds understanding for us partners, but also for those local households and communities that we're working with. My colleagues will now present a bit of insight also on post-event and after events when we go into post-event analysis where people and households are impacted. My colleague Raquel will present evidence here, and my colleague Zhang Yi will present insights on the interventions our partners are implementing and what can be gleaned from those interventions. So thanks a lot, and over to Raquel, please.
Thanks, Reinhard, and it's a pleasure to be here in this evidence pavilion to talk about a little bit of our work on impact evaluation, on the effect of community resilience on health outcomes after floods, using the framework of the Zurich Climate Resilience Alliance. A little bit of background and motivation for the themes. Floods can be considered the world's deadliest environmental extreme, and those health impacts of floods could be deaths, could be injured. If you go to the literature, you can see that they are shaped by the age of the population, by their gender, by the hazard of the flood and the exposure of the community. However, field studies have assessed how community resilience, which is the central part of the Climate Resilience Alliance, have affected post-flood-related injuries and deaths, controlling for demographic profile and flood hazard exposure, as put it into literature. So this study will examine 66 communities across 7 countries using the Climate Resilience Alliance dataset, which is a global standard for measuring resilience. Our research question is the causal effect of resilience on health outcomes. So as we are on an evidence pavilion, I think we have an audience of impact evaluators. And basically, we use econometric models to assess what's the effect of resilience capitals, which were assessed before a flood event, on health outcomes, which were observed after the flood. So the concept here is that communities with stronger baseline resilience experience would have better health outcomes after floods. So our hypothesis is higher resilience leads to fewer injuries and lower mortality. That's the question, the causal question that we aim to answer with this work. We use a quasi-experimental research design, as randomized controlled trials are not possible in the settings. The outcomes that we want to understand is the immediate deaths after the flood, injuries, and what we call delayed deaths due to diseases 3 months after the flood, which can be due to diarrhea, typhoid fever, cholera, leptospirosis, among others. The impact variables are the 5 capitals of resilience in the Climate Resilience Alliance framework, which are human, social, physical, natural, and financial capital. And to control for the observed heterogeneity that confounds the causal effects, we use the literature to control for the age composition of the community, the gender composition, rural, urban, the hazard, and the exposure. Some of the results on the fatalities, we found that none of the resilience capitals had a statistically significant effect on immediate deaths or delayed deaths at 1% level, except for natural capital, which exhibited a positive causal effect on delayed deaths. That was an unexpected result. According to the literature, we would expect that all resilience capitals would negatively impact the outcomes, the health outcomes. So we found that a 1 standard deviation increase in natural capital was associated with 1.59 deaths. So by natural capital in our framework, we talk about the conditions, the priority natural unities, the priority managed unities, natural resource conservation, and natural habitat restoration. So what do we conclude is that communities more engaged in conservation and ecosystem-based activities experienced higher delayed mortality. And delayed mortality, again, we are considering the deaths that occurred 3 months after the flood due to diseases. So we speculate that this result might be due to the fact that nature-dependent communities might need safer settlements, not just ecosystem protection. As per the results for injuries, we found that social capital, 1 standard deviation increase decreases 40 injuries, and human capital, 1 standard deviation decrease injuries in around 6. measured before the flood were linked to fewer post-flood injuries. So why the role of social capital and human capital as resilience measures? Because social capital enables people to warn, evacuate, and assist each other, reducing the likelihood of injuries. And human capital builds the knowledge and skills to respond safely and avoid harm during floods. Together, these resilience capital, social and human, help reduce exposure and protect against injuries. So the conclusion of our model, which is published and the reference will be on the end of this presentation, is that the models indicate that social and human capital are statistically strongly and negatively associated with the average number of injuries. We have novel evidence whose rigorous econometric methods and rich data, but resilience, except natural capital, may not translate directly into reduction in flood-related mortality. This might entail complex mechanisms and temporal effects that are doing on the causal impacts of resilience on health outcomes. But we do think that reporting no results is essential to avoid publication bias, and it contributes to a more realistic understanding of the limits of resilience building initiatives in extreme events. So that was my part. Thank you. And I pass on now to John. Thank you.
Thanks, Raquel. So I'm shifting the gears a little bit, and now we'll be talking about interventions. Next slide, please. So as Reinhard well introduced, the programming usually begins with a really extensive participatory resilience measurement method, which you can see here in this QR code. The method can be, it's household surveys, focus group interviews. So it's very much measuring the resilience from a perspective of the community members themselves. And so what this enables is that everyone has an understanding of what the gaps, what the challenges, and also the unique opportunity for action beyond post this measurement. And so the community members with the implementing partners will set up a resilience action plan, develop a theory of change, and through an intervention identification to implementation process, ideally the programs would result in resilience outcomes. Of course, in this black box, you'll see that, of course, past experiences, support from external, internal investments, and the community priorities also have an influence, not just this, even though it is a circular process, there's no direct planning process of interventions. Also that our program is across 300 communities in over 15 countries. So there's a huge range and diversity. Next slide, please. But what this allows us to do is that over the past 5 years, the program has been around for more than 10, but in our second phase, we were able to identify over 200 interventions, ranging from, Raquel, if you can just click and then pictures will show up, where we have infrastructure improvements, nature-based solutions, asset protection, diversification, community engagement, knowledge building, community flood resilience planning and action groups, and then early warning systems. So a huge diversity, but at the same time, these are empirically founded 7 categories of kind of what's been done without any prescriptory activities, but rather from the communities themselves who have identified that these are the interventions that they want and can do to build community resilience. Next slide, please. But we were faced with one challenge at the end of our second phase in figuring out how do we measure these outcomes beyond just the resilience measurement tool that we have from an intervention perspective. We have been operating with a resilience measurement framework that kind of it has different lenses that capture the different systems and kind of frames of thinking, including well-being, development, climate adaptation, different systems of socio-ecological or socio-technical priorities. But when it comes to a project or an intervention result, I think one of the stemming questions was that, do we identify resilience as a moving signpost? And if so, what are they? And should it be a moving signpost? And if so, how do we use the right ones? So we try to look into our own inventory and try to answer these. Next slide, please. And what we try to do is map it out on what our expected and intended and also identified outcomes with existing kind of frames of how we can capture what the interventions are targeting. So in the middle, you'll see the 7 categories of interventions I just mentioned. And on the left side is which capitals, which is from the Sustainable Livelihoods Framework, financial, human, physical, social, and natural, which ones they're targeting. And then on the right side, you'll find the resilience building capacities, which are adaptive, absorptive, and transformative. And you'll find that mostly adaptive capacity is dominated, usually built through improved learning, flexibility, and planning. But we also have quite a lot of absorptive capacity, which is interventions that strengthen risk reduction measures. And still we have a very few, transformative capacity, we still have 10, which are fostering structural shifts such as advocacy, governance reform. But what the kind of key message here is that it's very multifunctional. So even if one intervention is being planned, the design and the activities that are being planned, even in the same category, is very diverse. Next slide, please. And I will skip over this, it's a very busy slide, but what we try to do is also try to see what are their dependencies, what kind of influences, which interventions are being implemented or selected and designed and implemented by who. And the quadrants kind of characterize the resilience grades. So the communities that are on the bottom left, the first quadrant, these are the most vulnerable in all capitals, versus in the third quadrant, this is the highest. So you'll find that in somewhat unexpectedly, the 2 interventions on the right, which is the infrastructure and planning, you find the most more, I guess, higher resilience graded communities to be implementing these interventions, versus the left side, the 4 interventions are being implemented by the more vulnerable or less resilient communities. Of course, these grades they're not comparable. So it's just from their own perspective, which ones they've identified and which interventions align. But so we have taken the note of this to just say that a differentiated methodology to do our M&E is necessary. Next slide, please. And so to kind of conclude, I think one of the emerging findings and ways forward for us is to develop a differentiated M&E by interventions, especially considering how rigorous, traditional M&E processes can be. We're aware that sometimes to build resilience, we really need to just do and act without, having too many procedures, which are these tried and tested. And we know that these work, that they're universally applicable, and they're mandatory for kind of high leverage and to make sure that we can really make our communities resilient, which include these education, infrastructure, food protection, sanitation interventions. And these just require activity and outcome tracking, while kind of the more innovative seed building resilience interventions, such as asset diversification, early warning systems, nature-based solutions, and community brigades, they really require flexible thinking and process-oriented M&E so that it cultivates growth and diverse approaches. Next slide, please. And on that, we conclude our talk. Reinhard, I pass it over to you.
Yeah, thanks, Johnny. Thanks, Raquel. Excited, exciting presentations, and that's hope that stimulates a little bit of a debate. I don't see a lot of comments yet. But maybe we can just talk a little bit more about the work we are doing. So I would have a quick question to Zhang-Yi, maybe a request to maybe go a bit more into detail on this issue about measuring as intervention, right? So we're measuring the interventions, but we're also suggesting the measurement by itself as an intervention. Maybe you can talk about this a little bit, what that meant. Yeah, thanks.
Yes, definitely. So we have this, I think we're starting to call this that the measurement itself is an intervention because it builds a common language for community members to begin and to, a common language to develop their own engagement-driven intervention. So before, maybe everyone had a different frame of thinking or had different understandings of their resilience, but thanks to our measurement framework and tool, it allows for a certain standardization of what people can kind of communicate over, and this in itself is a capacity building measure.
Yeah, thanks a lot, Zhang-Yi. Yeah, colleagues online, maybe you have some comments or question, can be critical, should be critical. So I would still, invite you to post whatever you want to talk about. We have a little bit of time, 8 minutes. Oh yeah, I see somebody here. I see two now. Oh my God. Okay. Yeah, William. Yeah, maybe I read it out. William Stebbins. So very interesting holistic approach, which I imagine requires extensive collaboration among partners to address the multiple facets from capacity building to financing. Oh yeah. Is there a measure for the effectiveness of collaboration? Maybe I just, this is a tough one, but maybe Zhang-Yi would be suited for this one. And maybe let me just read out the second one, and Zhang-Yi and Raquel, you see those. So the second one is regarding the findings on M&E of resilience outcomes and measurement itself being an intervention. Yeah. Could you speak to how widely these findings are in use? Yeah, that's also a tough one. Yeah, these are tough questions. Maybe more to Zhang-Yi, but also Raquel and I could also come in on both one, but these are super. Yeah.
Yes, thank you. So do you want to go, Reinhard?
No.
Then
I come back in later. Yeah.
Okay, maybe I can start and then please jump in. I think, thank you for these questions. I think, William, yes, indeed. I think every organization, especially because we are collaborating with 6 different implementing partners who have different priorities and expertise. I think the what is implemented and how is very much context specific. I think one thing we do find is that the expertise in-house of the implementing organization does actually quite significantly impact which interventions are being planned, just because they have the experience from I guess legacy or their in-house, so they don't need to necessarily find other resources. But I think what this alliance enables is that this collaboration. So there's a lot of cross-learning between organizations. So for instance, Practical Action is very much innovation oriented. So their early warning system has been a solution that other organizations also look at or reference, versus Plan International has more gender and inclusivity programming that other organizations will also reference. So I think, I'm not sure about the financing. I think a lot of co-financing is being explored as an alliance influence and advocacy agenda, but between the organizations, it's definitely something that's fruitful collaboration. Regard, yes.
Should I maybe take the other one?
Definitely.
We also here, we are stopping in 5 minutes, but I got some good comments. Question by Arunjana Das from India, from Assam, I think, right? If I got that right. Assam, Northeast India, yeah. Question being like how this intervention, so measurement as intervention, how much are these findings in use, or how much are they understood? Maybe start with the Alliance, our Climate Resilience Alliance. We got a number of NGO partners that work globally. We don't work in India, but we work in Nepal, close by, right? I would say almost this understanding of like measuring, surveying, households and community experts, focus groups. I would say almost doing that as an intervention is almost comes with our NGO partners that are embedded on those communities. So they would pride themselves on working with community partners on awareness and working with them on awareness issues, but also implementation. So I think it almost comes with engaging at that level. So partners are doing it, and they're doing it, I would say, rather effectively. So that's almost well understood. And that's what they, of course, what their target, what their objective is also in their daily work, I would say. That's okay, and that's also well understood. But what does this mean then also for global validation? We're in the Evidence for Climate Action Pavilion, so there's a lot of rigorous evaluation, M&E and evaluation work that is being presented. It has been presented today already, I guess. So can this be translated into statistics? And maybe I invite Raquel in a second to comment on that as well. I would say we have done it. So we have had a number of papers, so academic, peer-reviewed publications and journals that show actually that this intervention statistically makes a difference. It's a significant difference. So I would say what partners do really trickles down also without lots of biases into like concrete evidence that is credible and shows how it makes a difference. Maybe Raquel would comment on that. Raquel being our most rigorous statistics expert, I would say, like with Jean-Guy, of course. Maybe Raquel, you want to come in on that one?
Yes, I want to answer the question of Arun Juana regarding the external validity of our results, because we have data globally available for many countries, but we are on this exercise focusing on 66 countries, 32 being from Bangladesh, which have experienced floods. So we're really talking about Global South countries, and which have, some of them we have cluster analysis as well, which shows low resilience, and some communities who have high resilience. So, of course, our results are not generalizable to the entire globe, but they have internal validity. They can be quite strong for the 66 communities that we evaluated using this Zurich Climate Resilience Alliance data.
Mm-hmm. Yeah, thanks. There's another question by Claude Saint-Pierre. Does your work point to recommending sector-specific interventions or by type of extreme event, floods, as well as cross-cutting resilience? So that could be to both Raquel or Jean-Guy. I'll stay quiet. Maybe Jean-Guy, or you want to come back on this one? What's that? Or so like sector-specific, what works? I guess that's more the question, not the best, but what works or doesn't work. And then we have 1 minute only. Thank you.
I think for the definitely cross-cutting, I would say, I think we don't work on kind of the key community system sector perspective, but I would even argue that, so I don't think they are necessarily sector specific. We are working at community level, so I think it would look differently if it was on a national kind of planning prioritization. But yes, in the case of community level, what is working and what we find effective is that it's cross-cutting and it's really systems oriented.
Yeah, great. Yeah, exactly. There's some Claude Raquel also had a point, but I think we are out of time now. So saying that, let me thank the participants for those questions. Hope there's some more. I think you got our contact somehow, but please be in touch, and we're happy to also, I hope the presentation will be shared. We're happy to be in touch and discuss those issues with you. We're quite excited to be in the Evidence Pavilion. This is perfect, and this is what we want to do, engage in conversation. So thanks a lot, and everyone, a great time and, a productive time, of course, in Berlin. Thanks a lot. And Claude, let's be in touch. Also some comments. Thanks a lot. There's emails, please. Thanks a lot. Over to.
Thank you.
Thanks.